I think that it's hard to accept that all of us, we will going to die. And I think it's one of the reasons why palliative care is so much resistance about palliative care.
Providers have to be the voices of the patients. They have to be the advocates, advocating for palliative care to improve the quality of life of the patients they care for.
Whether you can access palliative care or not makes all the difference in the world for somebody who's severely ill or dying, but also for the whole family around him, for all his friends, and sometimes even for the whole village.
Those patients who suffer, they are so unhappy, and their relatives also very disoriented.
Because it's such a burden. If there is no health care available, if there's no relief of pain, if there's no access to opioids or to other essential medicines, then people will suffer miserably.
A lot of the people agreed that the systems are structured in ways that doesn't allow the individuals who need palliative care to be included in the healthcare system very easily. We have to find ways on how to do palliative care because the system is set up in ways that it's just for curative approaches.
We are involved in the system that is especially worried about curing the illnesses instead of caring the person, not the patient, the person.
We really need to know the personal stories, the stories of that child, that adult who has been cared for by a hospice, by a palliative care program, and the difference that it has made in the life of the child or the adult and their family.
My name is Naredi Kopani. I am 22 years old. I'm living with HIV and kidney failure.
It's about addressing the whole person needs plus the family. So it's a very holistic approach to the care.
Having home care workers that come by, having community nurses that can look at the patient, having opioids that can be taken at home, and then the patient is not in pain, is not crying, then that makes all the world of difference.
They've turned me around so that I can sit up and I can, it's a marvelous thing.
One of the problems for palliative care development around the world is actually understanding the need and being aware of the need. So in children's palliative care, we know that there's about 21.6 million children globally who need palliative care, and yet people don't know about the problem.
Palliative care still has not got the visibility, the acknowledgement, the understanding of not only the health professionals but also the general public.
The other problem is that healthcare providers aren't educated in it, primary care providers aren't usually educated in it, politicians aren't educated to know what it is, so they can't prepare policies and budget lines. So building in a palliative care element is absolutely crucial because many people develop diseases and conditions for which there are no facilities to prevent, cure, screen, what have you. The only thing available is palliative care if we can build it in.
We are sure, and there is a lot of information about this, that if we expose the medical students and the nurse students to palliative care, that is a great impact in the palliative care development.